if I were to pass on a message to the general public, first of all, recognise that not just children get the meningococcal disease, adults get it as well. You don't have to have a rash to have it. And secondly, it's really important that if you feel that you're not happy with the initial diagnosis, that you get a second opinion, because this thing works so quickly that that few hours or whatever time frame elapses can be the difference between life and death.
My daughter was a healthy child at 2:30 that afternoon. She died at 10 o'clock the next day.
I think they gave me a 10% chance of living on the first night.
I remember feeling that my eyeballs were actually almost rolling around inside my head. It was quite a feeling I'd never experienced before.
She just didn't even look like my daughter. She was bloated, she had this rash all over her, there was machines just beeping, there was doctors racing, and I just collapsed.
He also said that your little girl, Kimberly, is as sick as she can get. She can't get any sicker than she is right now.
There was fluid coming out of his nose, his ears, everywhere. He just drowned in lung fluid and was gone from 14 hours from the onset of fever.
Meningococcal is a word that strikes fear into most of us because of the terrifying speed with which it can kill or maim and the difficulty of early diagnosis, even by experienced doctors. In this program, we'll learn more about the disease, how you can recognise it, and what you can do in those vital first hours to help save a life. Until fairly recently, most of us had never even heard of meningococcal disease. Then suddenly it started grabbing newspaper headlines with reports of lives lost literally overnight. And we're terrified of our families being at risk.
Look, it's terrifying for doctors who manage the disease. It's terrifying for mothers, fathers, siblings. It's a rapidly progressive, can be a rapidly fatal disease. People can die in a matter of hours. And I have seen cases where somebody has been well at breakfast and dead by dinner.
Okay, I can go from being completely normal to just literally a couple of days later having no legs.
From having a little healthy girl the day before, a little girl that played soccer and sport and didn't stop and loves animals, to having a sick little girl that may and could have died at any time.
If I had waited another half an hour, I probably wouldn't be here at the moment, so that 30 minutes isn't much time when you think about it.
I was demented in the end, to the point where I didn't know my wife and didn't know my kids, and that was all in the space of about 12 hours.
On the Tuesday I was feeling a bit off, Wednesday I was feeling tired, and then the Thursday I was on life support.
It can start off very, very minor and mild, like a flu, a bit of a rash, bit of a headache, some fever, some chills. The rash may be very non-specific, a little bit of a pink blotchy rash, and so many other things can look like this. So it requires a lot of vigilance, being aware and constant observation to make sure that this isn't something that's going to progress into severe meningococcal disease. Because once it starts to progress, it can progress with frightening rapidity, like a bushfire taking off, really.
Even now, we still can't believe that it was so quick. I mean, it was like that. It was just a moment.
Meningococcal disease is caused not by a virus, but by bacteria, the meningococcal bacteria, of which there are many different strains. These bacteria live naturally in the saliva of our throat and nose. They're spread by activities such as sneezing, coughing or kissing, sharing food, drinks or cigarettes, using someone else's toothbrush or lip gloss, even sucking on the end of a pencil. Active or passive smoking can increase the risk. However, the bacteria only live for a short time outside the body, and even if they are passed on, it doesn't mean you'll become ill. In fact, 10 to 20% of people at any one time will be carrying these bacteria for a few weeks or a few months without any harmful effects. All of us will carry them at some stage in our lives. The danger occurs if you pick up a strain that you don't have any natural immunity to, or if your immune system has become weakened. Then it can strike without warning.
Well, we've just come out of the movies because I took him to the movies for the last day of the holidays, and we walked out of the movies. That moment, split second of getting out, she turned around to me and said, "I've got leg pain, I can't walk." And in a space of 3 hours more, she vomited. We took her to the doctors with leg pains, and that's the only symptom besides the vomiting, which wasn't even that much, it was only a little tiny bit, that she had.
Julie and Craig lost their daughter Rebecca the very next day.
Stephen was the shining light in our life. The afternoon that I picked him up from school, he was well, he came running through the door. He was normal. There was no lead up to this until 5:30 when he came down with a jumper on and said he was cold, but in actual fact he was boiling hot.
7-year-old Stephen lost his fight for life before the next day dawned.
The general reaction was from his school friends. But he was perfectly well when he left school last night. I mean, we're talking about a child that left school and before school reconvened the next morning at 9 o'clock was dead.
People of any age can get this disease at any time. But there are two age groups most at risk. Babies and preschoolers, because of their less developed immune system and tendency to put things in their mouth and share food, drink and toys. And teenagers and young adults, because they're such a socially interactive group. Environments where people are in close contact make it easier for the bacteria to spread, such as daycare centres, and in particular parties and nightclubs, where there's a risky combination of crowding, smoking, kissing, sharing drinks, and shouting above the noise, which disperses droplets through the air that can be breathed in by someone close by. Although you can catch the disease in any season, it's more common in winter and early spring. The many viruses around can weaken the body's natural immunity, leaving it more vulnerable to attack.
So what can happen in a couple of days before the onset of the meningococcal symptoms is there can be viral symptoms to start off. So the usual sore throat, muscle aches and pains, those non-specific things, so they can occur for a couple of days. But once the meningococcus is starting to get into the bloodstream, that's when things start getting bad quite quickly. In fact, very quickly.
While around 10% of those infected will die and another 20% will be left with permanent disabilities, the majority of people who get this disease recover fully with no long-term effects. Daisy was in hospital for 8 days, but she's now back to normal.
She was so lucky. It looked like she'd been bleeding internally, and you just don't know what the repercussions of it are going to be. And I really didn't expect that she was just going to be absolutely fine. It's just like having a miracle.
I knew enough before it happened, and I told my parents of the symptoms because they were minding Cassie a lot, and I was concerned about it. It just kept popping up, that disease, and it just never hit me that it had happened or that I'd have to know what I was looking for. But if I hadn't have, Cassie wouldn't be here.
What's often confusing is that meningococcal disease is actually made up of two different illnesses. It can appear either as meningitis or as septicemia, depending on which part of the body the bacteria invade.
There can be meningitis alone, so infection of the lining of the brain and the spinal cord, or there can be septicemia, which is infection of the bloodstream, which is the most severe and lethal form, or meningitis and septicemia can coexist together.
It's the more dangerous septicemia which can lead to amputations, skin grafts and scarring, and sudden death. The distinctive purple bruise-like rash, which usually appears in the advanced stages of septicemia, is actually blood leaking from damaged vessels into the skin. At this stage, the patient can go into shock, their blood pressure falls, and abnormal clotting can block off blood vessels in the extremities, the fingers, toes and limbs. Robert was 18 months when this was filmed. Miraculously, he survived with limbs intact, and now at the age of 6 has only some minor leg problems to deal with. 9-year-old Danielle lost her arm and some fingers when she was a baby, while 5-year-old Katie Tara makes do without her legs. It all depends on how early it's detected and treated. Recognising the disease in the critical early stages can be difficult because it can often be mistaken for less serious ailments such as gastroenteritis, muscle strain, a hangover or the common flu. To make matters worse, the symptoms vary from person to person.
Having had the flu many times in my 52 years, I can assure you that my symptoms were nothing like the flu.
Adding to the confusion, the disease can have different symptoms depending on whether it develops into meningitis or septicemia.
My symptoms were sore joints, sore eyes, sore neck, belting headache like you've never had before. I got to the stage where I could have just smashed my head up against a cement wall and felt quite comfortable about that. I was demented in the end.
Symptoms common to both meningitis and septicemia include fever, nausea or vomiting, tiredness or drowsiness, irritability or agitation, and possibly a rash. Specific meningitis symptoms include a severe headache, a stiff or painful neck, sensitivity to light, and convulsions. However, septicemia could start off with cold hands and feet, cold shivers and chattering teeth, or aches and severe pain in the muscles, joints, chest or abdomen. Later symptoms could include diarrhoea, rapid breathing or breathing difficulties, or a pinprick or purple rash. The danger signs of septicemia can easily be overlooked if you're watching out only for the signs of meningitis.
The symptoms I'd heard were all the other ones, the standard set, the throwing up, the eye soreness and the stiff neck. But she was really sore in the body in different parts that I hadn't heard of, especially in the buttocks. It was really sore for her to sit down.
She wasn't complaining, she wasn't disoriented, she didn't have any neck pain, she wasn't complaining of a headache.
She did not have one headache. She had a fever for about 10 minutes and it wasn't even that high. No stiff neck, nothing at all.
From the mothers that I have spoken to, not one of their children have ever had a stiff neck or been upset by a light. Their major things have been sore joints, sore elbow joints, sore knee joints, their wrists hurt, their body aches.
Because all cases are different, it's critically important to be aware of the range of possible symptoms and to use your gut feelings to decide whether the illness is in any way different, more severe, or more rapidly progressive than what you'd normally expect.
I guess that's why I was concerned about her in the night, because she was breathing quickly. She wasn't breathing as a child normally would when they're asleep.
Yeah, I was just shaking and feverish, just swinging between hot and cold, and it's just really scary. Yeah.
Felt really tired and really weak, even more, and really cold as well. Drank about 8 litres of water throughout the night.
She just looked grey, like her face looked grey, and she had these big whitey grey and these really huge, dark bags under her eyes, and her face looked swollen.
She sat on the lounge and she said, I can't walk, my leg is in pain, I can't walk at all. My husband said, no, this can't be normal.
He had a fever that wouldn't react to Panadol. He vomited 3 times, but it was unusual vomiting. It was just more clear liquid vomiting, not like a meal sort of vomiting. And he was tired. And then he said, I've got pains in my tummy and my chest. So we just packed him up and took him to the hospital. We actually thought he was either having a heart attack or appendicitis.
Because you can deteriorate so rapidly, it's important to closely monitor anyone who becomes ill. Young adults in particular should alert a friend, flatmate or family member of their condition and ask them to make regular checks.
Fortunately, my mum came in at the right time. A lot of people make, whether it's a mistake, make the decision to go to sleep, take a couple of Panadol, I'll go to bed, I'll sleep it off. And unfortunately, that's where a lot of people can get themselves into pretty difficult situations, just falling into the coma and actually dying without knowing what's actually happening.
I was about 30 minutes in the shower and Bronx sort of was wondering what was happening and knocked down the door and found out I was collapsed on the floor, so I passed out in the shower and don't remember anything.
When I woke up, I rang my stepsister and told her to pick me up and take me to a doctor. And she was there within half an hour and took one look at me and told me that she was going to take me to a hospital instead. Obviously I'd come out with the purple rash then.
If a person is ill, it's vital to check their whole body at regular intervals for any sign of a rash, which could start off anywhere, behind the ears, on the torso, even the soles of the feet.
Don't ask me why, but I lifted up her singlet and looked at her stomach and there were the spots coming out. And I just knew it was meningococcal.
It's a common misconception that if you haven't got a rash, you haven't got meningococcal disease.
And I sort of went through the symptoms individually. I thought, yeah, I have got that, I've got that, I've got that. But then I came to the rash and I didn't have a rash. And I thought, well, no, that's not what I've got.
In fact, you may not see a rash at all. And if you wait until you do, you may well be too late to stop the disease, causing irreparable damage or even death.
All Donna told me was a high temperature and blood spots coming to the surface. That was exactly what Cassie got another 12 months later. And if Donna hadn't have told me that, it wouldn't have rung alarm bells in my head that this is what it was. Looking back on it now, I probably would have taken it as being the rash for scarlet fever because of the colour. It was a purpley maroony shade. So I am sure, without a doubt, I would have waited. And I possibly would have waited too long.
It may start off anywhere on the body, often just as a faint pink rash, or as a red spot, scratch mark or blister, or as tiny pink, red or purple pinpricks, which rapidly turn into red or purple blotches like bruises as the bleeding spreads. When checking for a rash, you need to be vigilant because at the beginning it can easily be missed or mistaken for something else.
To start off, they did look like chickenpox spots, little pinpricks to start with, and but small and scattered.
The one on her stomach, actually, she showed it to me. It must have been that morning, and it looked like a scratch. It looked like a fingernail scratch, but it was sort of purpley behind it.
One stage there we thought it was a bite mark because she had a little mark on her leg, on her right leg down the bottom, and we thought, well, because my parents are on a property, that she got bitten that day that we were there.
I just noticed a spot on my leg. I thought it was an ingrown hair because I washed my legs. But yeah, I didn't think anything of it. It's just a red spot on my leg. So, and then it started to get bigger as I got to the hospital. And
the rash is one of the final symptoms of septicemia. This happens when the bacteria enter the blood vessels and multiply rapidly, releasing toxins or poisons which damage the walls of the vessels so the blood can leak through.
The patients can literally bleed to death in a matter of hours, I might add.
So quick. 1 minute she's a girl covered in white skin to a girl covered in this purpley skin. And it looked like the white skin was the foreign of her, not the purple. Actually, if you got beetroot and you splattered beetroot all over you, that's actually the colour that Kimberly's rash was.
Some people use a glass test to see if the rash is septicemic. In most cases, a septicemic rash won't fade if it's pressed firmly with a glass or your thumb. But be warned, this test is not 100% reliable, especially in the early stages. So if a rash does appear, along with some of the other symptoms, don't try to diagnose it yourself, seek urgent medical attention.
The 2 points that he had on his neck when we left home, by the time that we got to the hospital, which is a 20-minute drive from here, 75% of his whole body was covered in this hemorrhagic rash. And as they were undressing him, the few parts of the body that it wasn't on, we were literally just watching it. It just was just going up him all over. And at that stage, he was in agony.
The range of possible symptoms, firstly in children and adults, include a fever which may not respond to paracetamol, nausea or vomiting, lack of energy, tiredness or drowsiness, confusion or disorientation, dizziness, irritability or agitation, a sore throat. Specific meningitis symptoms include a severe headache, backache, a stiff or painful neck, sensitivity to light, twitching or convulsions. Specific septicemia symptoms include a fever with cold hands and feet, cold shivers, severe aches or pain in the muscles or joints, severe pain in the chest or abdomen, diarrhea, a very pale or blotchy complexion, rapid breathing or breathing difficulties. In the later stages, a pink, red or purple rash, which may start off as pinpricks and develop into bruising. For babies, there are some additional symptoms to watch out for, including refusing food, a high-pitched or moaning cry, arching of the body or neck, and a bulging fontanelle, that's the soft spot on the top of the head.
If you suspect meningococcal disease, rush the patient to your doctor or nearest hospital. Insist on seeing someone straight away and clearly list all the symptoms. Remember, if it is meningococcal disease, you need treatment as soon as possible.
Probably around about 3/4 of all the deaths with earlier treatment would have been preventable. So don't give up, don't be put off. If you're a parent or you're a brother or a sister and you're not happy, just keep hammering away. You might have to take your child to another hospital or to another doctor, but don't give up. And just because they say it's not meningococcal disease and you're keeping vigilant and you think that your child's not improving or getting worse, then keep hammering away.
Time is so much of the essence in this case that every minute that is lost not dealing with it is 1 minute nearer to an absolutely disastrous or consequential result.
Make a stand for yourself. Question it. They don't answer your questions. Do what I didn't do. Go back and ask again. Go back and reconfirm it, because you're not going to get anywhere otherwise.
Even very experienced doctors, and I've done this myself, even very experienced doctors have missed the diagnosis. And it comes back to just what we said about the parents before. The doctors have to be vigilant as well, and you've got to go back and see that patient again and again and again. So don't send those patients home. If you think they might have meningococcal disease, keep them in. You might just want to keep them in the observation ward or whatever, or if you're a GP in the country, go back and visit them again in another hour or so, but keep your eyes and ears open, listen and look very carefully. The treatment rests very much with antibiotics. The meningococcus, the organism causing meningococcal disease, is still very susceptible to good old common garden penicillin. The message for the GPs is if you suspect you've got a case of meningococcal septicemia, don't worry about getting the cultures off to the laboratory or whatever to prove the diagnosis. Give the antibiotics straight away. In fact, what we're suggesting is best is the GP gives the antibiotic into the vein, gives it intravenously rather than into the muscle where it might form into a depot. Give it into the vein straight away there at the home or in the surgery or whatever, and then ship the patient straight off to hospital. So early antibiotics, that's vital. That is the cornerstone of effective treatment of meningococcal disease.
They said the GP saved her, because when she got to the hospital, they said she was shutting down.
As soon as she saw Daisy, she just went, oh my God, and she just immediately put her on a table, put a line into her, took bloods off, gave her IV antibiotics, a huge dose, called the ambulance. She just did everything possible. She knew as soon as she saw her that it was meningococcal.
Now, all drugs can have side effects, so we're not advocating wholesale administration of antibiotics to every child with a bit of a fever and a rash. What we're saying is if it looks like a progressive illness and that child's getting worse over a matter of hours, then give the antibiotics. Err on the side of caution there, because the risk of antibiotic is a lot less than the risk of untreated meningococcal disease.
Anyone who's had close contact with the patient in the 7 days prior to their illness appearing, including people who live in the same house and close kissing contacts, should be treated with oral antibiotics. This kills any possible bacteria in the throat or nose and helps stop the spread of the disease. However, this doesn't mean you're fully protected, so you should still be on the lookout for any symptoms. The incubation period, or time between picking up the strain and when the symptoms appear, can be anywhere between 2 to 7 days.
Hello. Hi. It's me, Cassie.
If someone you know is recovering from meningococcal disease, there's no need to keep your distance, because after treatment, they're no longer a risk.
For a long time, she didn't have any little friends around. A lot of parents were worried to put their child around Cassie or me. Just ignorance. They just didn't understand.
When they're out of the hospital situation, just treat them normally because they're like anybody else. Don't treat them like a leper or shun them or whatever. Treat them normally. They're not going to be transmitting the organism from their throat elsewhere after they've left the hospital situation. In fact, probably in the first 24 hours of treatment, they would have gotten rid of it from their throat.
Apart from the emotional trauma suffered by the person and their family, many will also have long-term physical disabilities, ranging from headaches, sight and hearing problems, to liver or kidney failure, scars or amputations.
She was on life support for 17 days, in the intensive care unit for 5 weeks and in the hospital for 3 months. So she had to learn to walk again, she had to learn to eat again, she had to learn to write again.
She had a lot of pain in her body and a lot of problems, and her fingers were falling off, and then they were operated on, and then she was having the scar management treatment. And just gradually over the years you can see she's coming back to being a normal little Cassie.
Her first toe decided it wanted to fall off. It just broke off. And so we had the toe fairy, the finger fairy and the tooth fairy, because at that time Kimberly was losing a few teeth and a few toes and a few fingers. And the toe fairy, finger fairy used to bring $50 per finger or $50 per toe.
Yeah, my kidneys, they'll probably end up being 100% in the future. But at the moment they're about 60% and they're slowly getting better.
Well, I was in a coma for 2 weeks and my legs were actually amputated on the second night, so I was unaware of what was actually happening. So I woke up the 2 weeks later and I didn't realise at first that I could actually have prosthetic legs. Thought I'd be in a wheelchair, and that didn't bother me that much, but when I found out I could have prosthetic legs, that was just fantastic.
It's been very difficult for me with the arms, obviously because it's so debilitating, but more so I've had a loss of playing guitar and things that I love doing, and it just takes your independence away so quickly.
There are vaccines available, but they don't protect against all strains or serogroups of meningococcus.
The predominant groups differ from country to country and even from state to state. In Australia, the majority of cases are caused by Group B, for which there is no vaccine currently available. There is now a vaccine for Group C, which accounts for about 1/3 of cases, but has a higher rate of more severe disease, complications and death. There's also another vaccine recommended for travellers, which gives short-term protection only against a variety of strains.
Right, relax your leg there.
Okay.
You okay? That's a go.
Under the federal government's new vaccination program, children and teenagers from the age of 1 to 19 will be progressively vaccinated against C strain free of charge over the 4-year period from 2003 to 2006. However, people of any age can be vaccinated by a GP at their own cost. For adults and children over 12 months, just one vaccination is needed. For babies under 12 months, a course of vaccinations is necessary.
Now, since she's over 12 months of age. She only needs the one shot, so that's good. If there's any problems, if she feels unwell or any reaction at the site or a fever, let me know, but it's an extremely safe vaccine.
I think you really need someone as an example to say, hey, it can happen to you, do you know what I mean? So go and take the precaution.
But remember, while vaccination will give you long-term protection against the deadly C strain, it won't protect you from catching another strain with the same symptoms, which can also cause death. So it's still important to be vigilant and to take other precautions. Parents, carers and teachers can help prevent children catching meningococcal disease by keeping a watchful eye in the home, classroom and schoolyard and at sports functions and school camps to check that good hygiene practices being followed. As meningococcal bacteria are passed on via saliva, it's important to warn students against sharing items such as food, drinks, lip gloss, toothbrushes, cigarettes, mouthguards, even musical instruments with mouthpieces.
I'm not going to tell any family member not to kiss another family member on the lips if they so want to, but what I'm saying is good hygiene's important. Don't share eating and drinking utensils, it's just good common sense. Don't share knives, forks, glasses, don't share toothbrushes, etc. That's important not just for meningococcal disease, but important for transmission of a whole lot of other infectious diseases as well. So it's just good common sense. But I think we should put all this into perspective about the fact that meningococcal disease is still overall a fairly rare disease in Australia.